Kelly.
Thank you. Mr. Speaker, I ask for unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous material on the subject of my special order.
Without objection.
Thank you. I thank the distinguished gentleman from the Garden State, my good friend Donald Payne. I'm glad he's back and in better health, for leading this Congressional Black Caucus Special Order Hour on the state of black health. It has been the refrain of so many people of all races across the country that Black lives matter. We've gathered here this evening because Black lives do matter, whether we're talking about issues of justice or economic opportunity or the health of our nation. Black lives matter. The topic of tonight's Special Order Hour is the state of black health, a CBC assessment during National Minority Health Month. Each April, we observe National Minority Health Month to raise awareness about the gaping health disparities that impact communities of color across the nation. Many of us have been personally affected by the physical and emotional tolls that conditions like obesity, diabetes, kidney disease, breast and prostate cancer, and HIV/AIDS have wrought on ourselves and our loved ones and neighbors. Last month marked the 50th anniversary of the Selma to Montgomery marches, the generation-defining events that led to the passage of the 1965 Voting Rights Act. Like the right to vote, health care is a fundamental civil right that our leaders, health professionals, and communities must fight to protect. The Affordable Care Act was a critical step in the march toward health equity, but there's still much more to be done. Dr. Martin Luther King expressed this a half-century ago when he said, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." I couldn't agree more. It has been the work of the CBC and the Congressional Black Health Brain Trust that I chair to advance the critical phrase of the human rights and civil rights struggle, health equity. This year, the CBC Health Brain Trust will focus on 3 core principles: strengthening our communities, improving health access, and marching toward a healthier future. The disparities facing minority communities in rural areas across the country are too numerous to name. To that end, the Congressional Black Caucus Health Brain Trust will work vigorously to address the gaps that exist when it comes to reducing heart disease, kidney disease, lung ailments, stroke, oral health, lupus, child nutrition, HIV/AIDS, mental health disorders, gun violence as a public health threat, and other chronic and infectious diseases. I'm glad that during tonight's hour, we will be focused on strengthening our public health infrastructure and developing community-oriented, multidisciplinary approaches to public health that will close the national health disparities gap. This National Minority Health Month, the CBC will work to expand access to health care, early health education, and medical investment so that we can make our communities healthier and reduce the prevalence of diseases that disproportionately cut minority lives short. Again, I thank my co-anchor for the next hour and yield back the balance of my time.